Welcome to this explainer. Today, we're diving into something that is absolutely fascinating, but honestly, totally counterintuitive. We're going to uncover how your go-to strategy for staying safe while walking might actually be increasing your risk of a fall. We'll look closely at the exact mechanics of our steps, how our brains process the fear of losing balance, and most importantly, how we can use that knowledge to rebuild a much steadier stride.
Real quick, here is our roadmap for today. We'll kick things off with the paradox of safety, explore what's called the fear avoidance cycle, and pinpoint some urgent medical flags you need to know. Then, we'll get into the 4-step sequence, walk through the 5 levels of practice, and finally, wrap it all up with a super practical 7-day action plan. All right, Section 1, the paradox of safety. Let's tackle a really common reality about how our bodies instinctively react when we're afraid of losing our balance, and why those gut instincts can sometimes lead us totally astray. I want you to picture this. You're crossing a room, say your own kitchen. Your eyes are locked on the floor, your steps are short, and your feet are barely clearing the tiles. Now, in your mind, it feels like you're just being careful. But here is the crazy paradox. If your toe happens to catch the edge of a rug, that low, guarded step leaves your body with way less time to recover. You see, older adults don't always begin shuffling because they're careless. Very often, it's actually because they're trying to be more careful. The exact strategy you're using to reduce uncertainty is literally reducing your margin for error.
Let's do a quick, honest self-assessment of your mobility. You know, these subtle changes almost never show up all at once. Are your steps maybe just a little bit shorter? Do your arms swing less than they used to? And take a look at how you navigate your space. Are you reaching out for walls, countertops, or the back of a chair, even when you aren't actively losing your balance? There's this really powerful story from our source material about a man who walked to buy his morning newspaper every day for years. But slowly, things shifted. First, he switched to a closer store. Then, he stopped going altogether on rainy days. Eventually, he just started asking someone else to pick it up for him. His family thought he just lost interest in the news, but he hadn't. What actually changed was his trust in the steps between his front door and the sidewalk. So take a moment and notice if your world is slowly shrinking because you're subconsciously avoiding those ordinary, everyday moments.
Moving right along to Section 2, the fear avoidance cycle, or what is essentially the brain's protective trap. Now, this completely demystifies a core biological mechanism behind that changing stride. A change in your gait isn't always just about your muscles getting weaker. A lot of the time, it's actually about the memory of what almost happened the last time you lost your balance. Say you slip in the bathroom and you quickly grab the sink. Phew, nothing is broken. But your brain, it deeply remembers that sudden loss of control, and it ends up trapping you in this fear avoidance cycle. Your body isn't failing you on purpose, it's just trying to protect you using the strategy it genuinely believes is the safest. But because those steps are now much lower, your toes are way more likely to catch a rug. And what happens? That causes another stumble, which just confirms the initial fear. The whole cycle just feeds right back into itself.
So, shuffling actively increases your trip risk. What's the way out? The solution is all about providing your body with new evidence. Because look, confidence doesn't magically return just by telling yourself to relax or be brave. It returns when you actually provide your brain with new, positive physical evidence of a foot lifting safely and landing completely under control. One successful movement, followed by another successful movement. That proprioceptive feedback, that feeling of safe movement, is exactly how that old fear finally begins to lose its grip. Which brings us to Section 3, urgent medical flags. We have to identify the root cause here before we try to fix anything.
A shuffling walk is something we can easily observe, right? But it's not the name of one single universal cause. There are actually 3 distinct patterns. First up, we have a gradual habit. This one develops over years, your confidence fades, but your body hasn't actually lost the physical ability. Second is pain or mechanics. This means the movement is being physically limited by joint stiffness or muscle weakness. And if this is you, don't force a pattern your body can't comfortably perform. And third, there is the urgent medical pattern, which has a very sudden onset. Knowing exactly which of these applies to you is an absolutely critical part of safely reducing your fall risk.
And that leads directly to a massive safety warning. If you experience any sudden red flags, things like sudden weakness on one side of your body, trouble speaking, blurred vision, severe dizziness, new shaking, or this weird feeling that your feet are suddenly glued to the floor, please do not wait around to see if a walking exercise fixes it. Seek urgent medical evaluation immediately. These are stark warning signs, and they absolutely shouldn't just be dismissed as normal aging. Okay, Section 4, the 4-step sequence for rebuilding your stride.
For those of you dealing with a gradual habit and who have absolutely zero of those red flags we just covered, let's dive into the core solution. I literally just want you to remember 4 simple words. These 4 words are going to act as your blueprint for a steadier step. And remember, the goal here is not to take the absolute longest step you can muster. The goal is to find the step that you can control and repeat. And here they are. Lift, place, shift, push. First, lift. Don't slide the foot, just gently pick it up enough to clear the floor. Second, place. Let that foot meet the ground quietly and naturally, no stamping the heel down. Third, shift. Allow your body weight to move over the foot gradually, without just throwing your chest forward. And fourth, push. Use your back foot for smooth momentum, right into the next step. Lift, place, shift, push. Going through this sequence consciously is what actually retrains your foot clearance and weight transfer.
So how do you know if you're actually doing it right? Well, interestingly enough, a good walking pattern actually looks calmer, not more dramatic. You really want to feel a quiet landing. You want clear clearance from the floor, and your shoulders should be relaxed. If you find yourself leaning backward, tensing your shoulders to fight to stay upright, or taking a step so huge it feels like a lunge, you are trying way too hard. If that happens, just shorten the step to stay inside your zone of control. I can't stress this enough. More distance is not always more progress.
Let's move right into Section 5, 5 levels of practice. This is our structured path forward.
Now, we build this into a really well-scaffolded learning process. These 5 levels, they are not a test you have to pass in one single day. They're a gradual, gentle progression. Level 1 is the supported lift, literally just relearning how to release your foot from the floor while holding onto a sturdy counter. Level 2 connects the full sequence, but just for 6 to 10 steps at a time. Level 3 is finding your stride, discovering your own safe distance. Level 4 is the slow motion walk, which acts like a magnifying glass to show you exactly what parts of the step you might be skipping. And finally, Level 5 is obstacle clearance, safely stepping over something small, like a rolled-up towel. You only progress to the next level when the current one feels completely steady and under your control.
The totally crucial point here is managing your cognitive load. You might be practicing your new steps flawlessly in the hallway, right? But the second you walk into the kitchen, someone calls your name, you reach for your keys, and boom, the shuffle instantly returns. Why does that happen? Because walking isn't the only task your brain is trying to handle right then. When your attention gets divided, your body automatically defaults to the movement pattern it knows best. So the golden rule is do not multitask. Stop your feet completely before you turn your head. When the task gets complicated, your walking just has to become slower and simpler.
Finally, we reach Section 6, the 7-day plan. Let's take some action.
Over these next 7 days, your goal is definitely not to force huge steps or push yourself until you're exhausted. Your goal is safe, deliberate repetition. On days 1 and 2, I just want you to observe your walking. Don't change anything, just watch. Does your foot actually leave the floor? Then, on days 3 and 4, try out those level 1 supported leg lifts we talked about. Keep an eye out for tense shoulders. On days 5 and 6, practice a slightly more comfortable stride with a few slow, controlled steps. And by day 7, you just combine whatever levels felt the safest for you. Keep the practice sessions short, okay? Don't start practicing poor movement just because you're getting tired.
I really want to highlight this incredible insight from our source material. The purpose of this first week is not to prove that you can walk like you did at 30. It is to protect the ordinary things that make life your own. I mean, that really hits the nail on the head, doesn't it? This entire explainer is ultimately about preserving your independence. It's about being able to walk to the door, step out into the yard, or move confidently towards someone you love. It's about taking your world, a world that fear might have slowly shrunk down, and gently, carefully expanding it again through deliberate, positive new evidence.
So as you track your progress over this next week, I want you to ask yourself this final, really important question. Are there places you feel less afraid to walk? Because reclaiming those spaces, step by step, is the true science of a steadier step. And remember, slow change does not mean it's too late. Pay close attention, practice safely, and give your brain the positive evidence it is craving. Thanks so much for joining me for this explainer. Start with just observing today and take care of those steps.